Okay.
Greetings, good afternoon. Welcome, everyone. My name is Twanda Hill. I am delighted that ARTH has partnered with King County Veterans Senior Human Services Levy, City of Seattle, Aging and Disability Services, Allstar Financial Insurance, and Community Living Connections. We are here today. We are hosting a Medicare open enrollment workshop. It happens every year. It begins November 1st and ends January 15th. And during this time, anyone can apply for health insurance through Washington Healthplanfinder. Today's topics, we're going to cover choosing and understanding your health insurance plan, the difference between Medicaid and Medicare, and where to get help with health plan enrollment. So before we dive in, please remember Zoom etiquette. When we're talking about Zoom etiquette, we are talking about mute your microphone when you aren't speaking, mindful of background noise and distractions, adjust your camera and lighting so we can see your face, and just to change your screen name to match the registered guests. And today's presenter is J.R. Gillespie. J.R. is known, he's the owner of Allstar Financial Insurance. He has an impressive wealth of knowledge of insurance and personal finances acquired from years of experience. He knows his subjects and is a true professional. At Allstar Financial Insurance, they take a holistic approach to financial services with products and services that make them unique. So, great job. So with that, JR, you can go ahead and take over the screen.
Wonderful.
There you go.
Okay. Well, so now we have another person. So
yes, Camille.
That is a
Camilla.
good thing. Yes. Okay. So I did want to make a couple of clarifications, or at least corrections. This is, of course, what I call the medical. Well, first of all, my name's J.R. Gillespie, and of course, the business is Allstar Financial. I've been helping people now since 1993. Twanda and I were just talking about how we've been out here, working in the Pacific Northwest for the last 30 years, and how nice it's been to be able to pull it off for the past 30 years. So we're both very, very grateful for that. And this is usually a pretty busy time of the year for me, because it is what I call medical insurance season. There is Medicare open enrollment, and Medicare, of course, is medical insurance for people age 65 and above. And then there is medical insurance through the Washington Healthplanfinder, and that open enrollment goes from November 1st until January the 15th. And we have basically two medical insurance systems in this country. We have, like I said, we have Medicare, and then we have just medical insurance. So I would normally start with Medicare. And I always tell people that, in my opinion, the best thing that can happen to somebody 64 is when they turn 65. And when they turn 65, then they become eligible for Medicare. And most people get get better coverage for less money. I mean, it's pretty significant. If you were paying full premium for a Medicare, for your medical insurance, and you're 64 years old, you might be paying as much as $1,000 a month for your medical insurance. And then you turn 65 and you pay $164. So I think that's a heck of a birthday present. And Medicare, of course, comes in two parts. You have Medicare Part A, which everybody gets, and then you have Medicare Part B, and that's when you pay the $164.50 monthly. Now, the things that you have with Medicare is that Medicare has some downsides. They don't cover prescription medications. It has some high deductibles. It doesn't have an out-of-pocket limit. And it has, doesn't cover a physical, doesn't cover dental or vision. So, and it doesn't cover custodial nursing care. So because of the things that Medicare doesn't cover, most people will get some form of a supplemental coverage. And this open enrollment period is specifically for what's called Medicare Advantage plans or Medicare Part C. And there are these Medicare Advantage plans that you could enroll into. And the plans, many of them are available at zero premium. So there's no additional out-of-pocket cost after, other than that $164. And you get really, really good coverage. And not to mention, they all include some additional benefits that you don't get otherwise if you just have Medicare A and B. Also, during this open enrollment period, if you'd like to, you can switch plans. So if you had a plan, let's say with United Healthcare, you could switch to Humana or WellCare or one of these other plans. And all of these plans offer, a variety of additional benefits. So if I was to go here to where I have Medicare plan options, and if you look at 2024 Medicare plan options, if you came to my website, and of course you can come, this is my website, Allstar Financial Insurance, and I have a little video where I go over some of the Medicare basics like I'm going through right now. And I did that with Brenda Charles, who's also a good friend of ours for over 30 years. And you scroll down and you can see I offer coverage with Regents and Humana and Primera and Kaiser and Molina and WellCare and Aetna. And these plans all have, different features and different benefits. And, usually what I'll do is I will sit down and go over, your doctors and your drugs and kind of tell you which of these plans is, the best one for you. Currently, I'm really, really excited about Aetna because Aetna has some benefits that I think that make them unique. One of them is, of course, they offer a massage benefit. So you can go in and get therapeutic massage 12 times per year with a $20 copay. And I know I currently, pay significantly more for a massage, and I'm a huge fan of massage. The plans include dental and vision. They pay for over-the-counter items, so you can go to CVS or to your drugstore, and they give you a little stipend of money on a prepaid credit card, and you can go in and get your ibuprofen or your vitamin C or your adult diapers. All of those things could be paid for with this prepaid credit card. They pay for alternative medicine. Alternative medicine is a benefit that is not covered by Medicare. So things like chiropractic and acupuncture, and if you need to see a naturopath or those things are not otherwise covered by Medicare. But if you had a Medicare Advantage plan, then those benefits are covered. And then most people get really excited because of this thing called Silver Sneakers, which is a health club membership, and it works at LA Fitness and 24-Hour Fitness and Planet Fitness and a number of different health clubs. Now, one of the things that I really like about the Aetna plan is that two things. One is that they give you this they call it an expense wallet, but once again, they're putting $100 on a prepaid credit card, and then you can use that money to pay your copays. So if you went to the doctor and let's say you had a specialist office visit and they said you had a $40 copay, well, then you could use that $100 and pay your $40 copay. Another thing they're doing, and this is what's really exciting me, and they give you different amounts with different plans, but one plan I like, they give you $800 per year, and you can use that money to pay for, if you played golf, you can use that money to pay for your green fees. If you are a skier, you can use that money to pay your lift tickets. If you have pickleball fees, or if you like to go camping and you need to get a tent or hiking poles or fishing rods, or if you wanted to go to a yoga class, they're giving you $800 per year, and basically you'll just send them your receipt and they'll refund you or reimburse you up to $800. They have another plan that actually reimburses up to $1,200 per year. However, that plan, I don't like the drug coverage as well. So if you're taking like preferred brand name drugs, then you might want to do the plan with the $800 reimbursement. But if you don't take any brand name drugs, then you might want to use the plan that has $1,200 benefit. And I really like Medicare Advantage plans. I always tell people, if I talk to a lot of people, most people choose Medicare Advantage, and I'm really excited about this Aetna plan in 2024. So if you don't have that Aetna plan, then you can certainly enroll into it. If you click where it says enroll today, you can put in your doctors, you can put in your drugs. Not only does it include the Aetna plan, it'll include other plans like Humana and WellCare and Molina, and you can kind of compare the plans side by side and see which plan is going to be the most cost beneficial to you. And then you can always call me and we can set up a time and have a conversation and look at your specific needs and determine the best plan. You can also do what's called a Medigap plan. Some people refer to them as Medicare supplements. I represent Regents, Blue Shield, and Premera Blue Cross, and Mutual of Omaha. If you have one of these plans, you can see that there's Plan A and there's Plan G. Now, if you were Medicare eligible before 2020, then you can also do a plan that's called Plan F. Now, a lot of people like supplements, and the thing they like about supplements, usually if you have Plan F or Plan G, is that you pay very, very little if you had to go to the doctor. So if you went to the hospital and you had Plan F, you would pay absolutely zero. Of course, the problem with a supplement is that they tend to be a little bit more pricey. Plan F or Plan G, you're paying, $250 or more for the monthly premium. And if you have, and you have to get a prescription drug plan in addition. So if you add those two together, you may be paying $300 or more. And then you won't have any dental coverage, and you won't have any vision coverage, and you won't have silver sneakers, or you won't have a health club membership. So I usually, which is why I would tell you that if I talk to 10 people, 9 of them, at least 8 of them, choose Medicare Advantage. And I would say with Medicare Advantage, you kind of pay as you go, but you're capped. And you're usually capped at about $6,000 a year. But if you had a supplement and you had, you're paying $350 monthly, $4,000 or $5,000 a year, and you're paying that whether you see the doctor or not. Whereas if you have the Advantage plan, you're paying $0 monthly. You're kind of paying as you go. And even if you went to the hospital for, and you were there for 2 months, you're going to have maybe a $2,000 bill because you're kind of capped at a $2,000 bill. And unless you go to the hospital 3 times in a calendar year, you're probably not going to reach your ceiling. In fact, during the last training I went to, they explained that fewer than 1% of people actually meet what's called the out-of-pocket maximum, which is the most you can spend in a calendar year. But if you have a supplement, or if you'd like a supplement, then you also have to add a Medicare prescription drug plan. So if you were on my website, you can see that I offer, WellCare and SilverScript and Humana, and you can certainly enroll into a prescription drug plan. And these plans can vary because a drug could be like a tier 1 drug with one company and have a $0 copay. And then the same medication could be a tier 3 drug with a different company, and then you'd have a $47 copay. So it's always a good idea to look at the different medications you take and compare them with different companies, because it can change the amount of money that you spend pretty significantly. Now, one thing that a lot of people get confused about is the differences between Medicare and Medicaid. And I get so many people that, don't really understand the difference between the two. And I always explain to them that Medicare is medical insurance. It's available to people age 65 and above, and for people who have been receiving Social Security disability insurance for longer than 2 years. Medicaid, on the other hand, is financial assistance for people with low income. So if your income falls below a certain limit, I believe that limit is about $1,470 a month in Washington. So if your income is less than that, then you can qualify for Medicaid also. So a lot of people who only receive Social Security and don't have any other income, and they didn't work a lot during their working life, then they will pay this, then they might be eligible for Medicare. And if you are eligible for both Medicare and Medicaid, then they have what they call special needs plans. And if you've listened to any of these commercials, then you know that they pay for healthy foods, and they might pay utility bills, and they give you a bunch of money that you can buy over-the-counter items. So like you can see how where Humana is going to give you $185 a month, and you can use that money for healthy foods, or to pay your utility bills, or to buy over-the-counter items. And once again, they give you a prepaid credit card, and you can use that money to pay for those things. There are other companies that I represent, and they all offer these special needs plans. And once again, depending on your doctors and your medications and your specific needs, one of these plans might be, a little bit more cost effective than one of the other plans. If you are receiving Medicaid, then you're probably not paying for any of these services. And once again, with these plans, you don't pay for any services, but you do get additional benefits, and it's the additional benefits that make them worthwhile. So these are kind of the options or things that you can pair and can shop. And like I said, I'm certainly happy to assist if you need any type of, if you have any questions regarding Medicare. Now, if you are under the age of 65, then of course, there's medical insurance available to you as well. And, we still live under the constraints, or, the provisions. What handles medical insurance is the Affordable Care Act. People still refer to it as Obamacare. because, it was enacted when Barack Obama was in office. And I always tell people the biggest tenets of the Affordable Care Act is that the less you make, the less you pay. And that's ultimately, kind of how the whole system worked. So let's say let's just put in the zip code. And let's say we're going to look at 2024 plans. I'm sorry, I should have clicked up here first. There we go. And then we're going to put in a zip code. And so let's say you were a 50-year-old and a 50-year-old male. And I'm just going to say you. And, if you, let's say it's just you by yourself, and let's say you make $70,000 a year, not 770, then you can see you would receive a $62 reduction in premium. Let's say you were making, $30,000 a year, then you can see that you would receive, I guess I put in too many zeros. Let me take out one of those zeros. 300 versus 30. But if you were making $30,000 a year, then you can see you get a $502 reduction in premium. So if you had a $502 reduction in premium, you can see you can find a medical insurance plan for as little as $1. So like if we went over here to where you can see your plans, you can see now in King County, you can see there are 54 different plan options, and they're all different companies. So you can have, this is Ambetter, but let me move this. But you can see companies that would be available to you are Bridgespan and Community Health and Coordinated Care, which is Ambetter, and Regents Blue Shield. So let's say you wanted to look at Regents Blue Shield plans, then you can do that. Now you can see that you have the full premium is $568, but because you get a $502 reduction, your monthly premium is $66. Now, if you were to, let's say, compare that with an Ambetter plan, you could do a similar plan. Let's say you were looking at this Cascade Bronze. You can see that their monthly premium is $430, and you'd have a monthly premium of 82 cents. Now that's a bronze level plan. All the plans are kind of like bronze, silver, and gold. So let's say we did a comparison and we were looking at a bronze plan, and then you wanted to compare with a silver plan, and then you also want to compare with a gold plan, and then you can let's move that. Where's the compare button? When I move the screen, can you guys see that, or you just see the screen I'm looking at? I'm just curious.
I can see that down below it says compare 3 plans.
But so you can't see us on camera because I'm moving that around on my screen. So I was just wondering.
So go up again on your screen.
Right.
Right now I'm seeing 112, and that it has 11 plans. Yes.
But you don't see, like I said, you don't see where
No, you probably have to refresh your screen to another.
Okay, no. Okay, no, you've answered my question.
Okay.
Uh, you have answered my question. Uh, other than I need to get this and move that out of my way. And then I can go here to where it says compare plans. So now you got all three plans. You can see the bronze level plan has a $6,000 deductible. Silver has a $2,500 deductible. Gold has a $600 deductible. And I always say you pay more per month and then you pay less when you receive service, or you can pay less per month and then you pay more when you receive service. So it's always kind of that question. If you have a bronze level plan, you can see you have a $50 copay. Nice thing though is that the first 2 visits to the doctor, you have a $0 copay. Same thing is true if you have to see a specialist. After that, then office visits are, subject to your deductible. If you have the gold plan, of course, you have the best benefits, but of course you have a higher monthly premium. And I usually, once again, sit down and talk to people, and we look at your drugs and we look at your doctors and depending on the plan, because these different plans or these different companies will work with different doctors, and that's usually the biggest difference with the different plans. If you like to go to Valley Medical or use the University of Washington medical system, you should not use Ambetter as your company because they don't work with University of Washington medical system. But if you go to Virginia Mason or CHI Franciscan, then Ambetter is an excellent choice. So it's just about looking at the different plans. And of course, those would be the biggest determinants of, whether or not which plan you would choose. And then I can certainly assist you because I am, one of the providers, or one where it says, if you're on the Healthplanfinder, if you were trying to enroll in these plans and it says, get help from a broker, I'm one of the brokers that you would be receiving help from. So that's kind of, what I have to say about this open enrollment period. If you're over the age of 65, then of course you're eligible for Medicare, and I can help you with Medicare plans. If you're under the age of 65, then you're probably going to go through the Washington Healthplanfinder, and I can assist you there. And then I also help people with life insurance and disability insurance and long-term care insurance. And one other thing that I would, and home care, like if you needed a home health aide, I have a plan that helps you with the cost of a home health aide. It is like all insurance, it's important that you have that coverage before you need it. A lot of people like to wait until after they need it and then they find out they can't get it. But that's kind of the whole point of insurance, is that you're protected before you have the problem. So with that said, I am going to end my screen share. And of course, I can answer any questions that you might have.